Hello, I'm Dr. Corinne Ruffsedge, and today I'm going to talk about tongue ties and lip ties in babies. This is when the frenulum, the part underneath the tongue, fails to differentiate away from the floor of the mouth during embryologic development. It often goes undiagnosed, and it can cause significant problems in the breastfeeding dyad. Things to look for in your baby is when it's feeding times are only going, he or she can only go for about an hour between feeds. Often the baby will fall asleep at the breast, so we'll have a couple of sucks and then seemingly fall asleep. You've got to keep waking it up. Often the baby will fall off the nipple. We'll often see that the baby's chewing on the nipple. The baby will often make a clicking sound at the breast because it's not able to get a good solid latch, because often these babies, as I say, have the lip tie, so they're not able to get a good flange on the top lip. You may find that the baby's coughing, choking, regurgitating, or seems to even have shortness of breath when they're breastfeeding, because sometimes these babes are even aspirating a little bit of milk as they're feeding. When the baby's not feeding, so they're just at rest, you'll often find that their mouths are open at rest rather than closed. The shape of the tongue, when they try to poke it out, often has a cleft or a dent, or could be heart-shaped at the tip. We'll often find that they're colicky and unsettled because these babies take in a lot of air as they're feeding, so often have a lot of gastrointestinal disorders and discomfort. And we'll see often with these babies' tongues, if you have a look in their mouth, that we call it a two-tone tongue. So it'll be normal and pink at the front, but in the back half of the tongue, the tongue is white. It has a milk residue because the baby's unable to lift the tongue to scrape that milk residue off, and it sometimes gets misdiagnosed as thrush. So these are some of the things that you can watch for in your baby if you've been having some breastfeeding difficulties. And yes, try to get your baby to a lactation consultant that understands both the anterior and the posterior tongue tie diagnosis.